Ethics for the Massage Therapist. This is an NCBTMB approved 3 continuing education hour class. Welcome. I will be your presenter today, and my name is Patty Nuovo. I'm a licensed massage therapist in Missouri and a certified massage therapist in California, as well as a naturopath. I've been a co-director of massage school and an instructor of several massage schools since 2000. My passion is business and ethics, and I love helping others grow their business. I've created this format to make ethics for the massage therapist interesting and informative. I'm also the author of 2 best-selling ebooks, Soul Accounting, The Power of Money and Emotion, and Solving the Riddle of the Money Mind in 4 Steps. Now for the continuing education online class guidelines. You can take as long as you like watching this NCBTMB approved online class for 3 continuing ed hours on ethics for the massage therapist. When you have finished watching the online class and completed your final exam, email it back to me at pcnuovo@yahoo.com. Please have your full name and license number on the final exam. I will grade the exam, and when you pass with 70% or higher, you will receive your certificate of completion for this NCBTMB approved online Ethics for the Massage Therapist class. If you have any questions, feel free to email me and I'll get back to you as soon as possible. And now, welcome to Ethics for the Massage Therapist. So sit back and relax and let's begin. In part 1, we're going to include the definition of ethics, the code of ethics, and standards of practice for massage therapy. Ethics is defined as the study of standards of conduct of a particular person or group. And ethical is defined as conforming to moral and professional standards of conduct. Definitions. The Code of Ethics is defined as a set of conduct standards, rules, guidelines, and values that govern and guide ethical business behavior of a company, a profession, or organization, and in our case, massage therapy. We often think of the term ethical as choosing to do the right thing. Our personal ethics are a precursor to our professional ethics. We are not likely to be more ethical in our professional lives than we are in our personal lives. As best stated by B.E. Benjamin in The Ethics of Touch, quote, "Self-accountability is the cornerstone of ethics. It's all about who you are and what you do when no one is watching you." End of quotes. Therefore, being ethical is when you have a well-developed sense of self-accountability. You're honest with yourself, and you're answerable and fully responsible for what you say and do at all times. As individuals, it's our capacity for self-accountability that keeps us functioning ethically and responsibly. Professionalism. How I define professionalism is that the massage therapist must provide optimum levels of professional services and demonstrate excellence in practicing by promoting healing and well-being through responsible, compassionate, and respectful touch. Now for the Code of Ethics for the massage therapist. The massage therapist shall adhere to the National Certification Board of Therapeutic Massage and Bodywork, NCBTMB, the AMTA, which is the American Massage Therapy Association, and/or the ABMP, the Associated Bodywork and Massage Professional Code of Ethics, Standards of Practice, Policies, and Procedures. Whether you're a certified or licensed practitioner or not, the Code of Ethics, Standards of Practice, Policies, and Procedures are established and are an excellent basic guideline for all massage therapists to implement in their professional and ethical practice. It states that all massage therapists shall strive to provide the best of care to all clients and to represent the field of massage therapy with integrity. Therefore, standards of excellence and professionalism apply to and should be adhered to by all. So let's begin with this NCBTMB's Code of Ethics. Code number 1. Have a sincere commitment to provide the highest quality of care to those that seek their professional services. Code 2. To represent their qualifications honestly, including their educational achievements and professional affiliations, and will provide only those services which they are qualified to perform. Code 3. To accurately inform clients, other healthcare practitioners, and the public of the scope and limitations of their discipline. Code number 4. To acknowledge the limitations of and contraindications for massage and bodywork and refer clients to appropriate health professionals. Code number 5. To provide treatment only where there is reasonable expectation that it will be advantageous to the client. Code number 6. To consistently maintain and improve professional knowledge and competence, striving for professional excellence through regular assessment of personal and professional strengths and weaknesses, and through continued education training. Code number 7. To conduct their business and professional activities with honesty and integrity and respect the inherent worth of all persons. Code number 8. To refuse to unjustly discriminate against clients and/or other health professionals. Code number 9. To safeguard the confidentiality of all client information unless disclosure is required by law, court order, or is absolutely necessary for the protection of the public. Code number 10. To respect the client's right to treatment with informed and voluntary consent. The massage practitioner will obtain and record the client's informed consent of the client or client's advocate before providing treatment. This consent may be written or verbal. Code number 11. To respect the client's right to refuse, modify, or terminate treatment regardless of prior consent given. Code number 12. To provide draping and treatment in a way that ensures the safety, comfort, and privacy of the client. Code number 13. To exercise the right to refuse to treat any person or part of the body for just and reasonable cause. Code number 14. To refrain under all circumstances from initiating or engaging in any sexual conduct, sexual activities, or sexualizing behavior involving a client, even if the client attempts to sexualize the relationship. Code number 15. To avoid any interest, activity, or influence which might be in conflict with the practitioner's obligation to act in the best interests of the client or the profession. Code number 16. To respect the client's boundaries with regards to privacy, disclosure, exposure, emotional expression, beliefs, and the client's reasonable expectation of professional behavior. Practitioners will respect the client's autonomy. Code number 17. To refuse any gifts or benefits that are intended to influence a referral, decision, or treatment, or that are purely for personal gain and not for the good of the client. Code number 18. Follow the NCBTMB's standards of practice. This code of ethics and all policies, procedures, guidelines, regulations, codes, and requirements promulgated by the National Certification Board for Therapeutic Massage and Bodywork. Standards of practice for the massage therapist. The NCBTMB's standards of practice. The purpose is to establish standards of practice for massage therapists, including those massage therapists performing chair and on-site or out-call massages. We will go over the next several points in the standards of practice for massage therapy. Conduct. Consideration should always be given to how you display and present yourself to gain respect of the public and other professionals in merited situations. The lack of this consideration will result in negative outcomes, such as alienating clients and colleagues and other healthcare providers, as well as potentially attracting clients who have sexual or unethical expectations. For example, if you're receiving a large number of calls from clients who think you are offering services other than massage, it would be a good idea to look at how you are presenting yourself, the means in which you advertise, and how you dress. You can also ask a mentor or a more experienced practitioner for their perspective and advice. Respect, dignity, and worth. As human beings, we are all worthy of being treated with respect, dignity, and worth. We must recognize that these are basic human rights. And as a massage therapist, you must always treat each client with courtesy, politeness, kindness, consideration, and esteem. You always want to treat people the same, no matter their race, religion, gender, size, age, or nationality. And yes, the golden rule does apply to the workplace, which is always treat others the way you wish to be treated. It's a good idea to implement policies and procedures consistently so that all clients feel respected. Even in a case when working with a client who is rude or inappropriate in any way, we can refuse to work with this client using clear and respectful communication. Respectfully telling a client something like, "I'm sorry, I do not feel comfortable working with you anymore." But you always should avoid saying things like, "You're acting like a creep." This can invite the client to argue with you about whether or not they think they are acting inappropriately. Respectfully telling the client your feelings of being uncomfortable eliminates the opportunity for argument. In a case where you might have a strong negative feeling toward a client and feel it's in their best interest of the client to refer them to another practitioner, you can say something like, "I would like to refer you to another practitioner who I believe will be better able to meet your therapeutic needs." And you want to avoid saying things like, "You have such negative energy. I just don't like working with you." You always want to be professional, considerate, polite when referring a client to another massage therapist or healthcare practitioner. Communication. Using good professional communication skills is essential for massage therapists. We are trained and educated professionals, and it's very important to present ourselves using professional communication skills if our clients are to view us as trained and educated professionals that we are. This will allow your clients to feel comfortable, it establishes trust, and builds a healthy therapeutic therapist-client relationship. Professional verbal communication. Our verbal communication should always be pleasant, clear, kind, and honest. You want to avoid the use of profanity at all times. And being pleasant, clear, kind, and honest with your client is essential, beginning with the phone call to schedule an appointment, to greeting them at their appointment, to interviewing them, and history taking, and during the massage and after their appointment, usually when payment is received and they schedule their next appointment. Words to avoid so as not to confuse clients that you are practicing medicine without a license. Those words are cure, and an alternative would be to use the word alleviate, improve, correct, balance, normalize a condition. Diagnose. The alternative would be to assess, measure, determine, evaluate a condition. Prescribe. Alternatives would be to recommend, suggest, advise, offer opinions to alleviate a condition. Treat. Alternatives would be one may handle, work with, relieve, balance, normal, or remedy a condition. And lastly, disease. Alternatives would be condition, problem, or imbalance. Nonverbal communication. Our nonverbal communication is equally as important as verbal communication. Our tone of voice, body language, the way we dress, our touch, and the energy we exude are the nonverbal ways we communicate. It's important that all practitioners constantly check in on the ways they are communicating nonverbally to ensure professionalism. Avoid nonverbal communication that could be received as being flirty, suggestive, provocative, unclear, and/or unkind. If you find yourself using any type of unprofessional nonverbal communication, you may need to refer that client to another practitioner. Professional dress. The way in which we dress is a nonverbal way of communicating, and it's certainly included in the ways we present ourselves professionally. You want to avoid wearing clothing that is not clean, modest, and/or professional. You want to avoid wearing clothing that could be interpreted as flirty, suggestive, or provocative. So tank tops and shorts may be fine for the beach or outdoors, but are not professional and do not promote a therapeutic environment. Written communication. Our written communication should always include the same professionalism as our verbal and nonverbal communication. This includes all advertising as well as letters, emails, invoices, websites, etc. with your clients. Always make sure that written communication is pleasant, clear, kind, honest, and has a professional tone. Again, you want to avoid any written communication that could be taken as flirty or suggestive, provocative, unclear, and/or unkind. And of course, avoiding the use of profanity at all times. Using professional, verbal, nonverbal, and written communication at all times with all clients will ensure that you are representing yourself as the educated and trained professional that you are. The environment. The environment in which we offer our services is another way we present ourselves as professionals. A safe and comfortable environment includes all properly cleaned areas where the client is exposed, which even includes the parking lot, the waiting area, the restrooms, and the treatment room. All areas should be free of debris and properly sanitized, including the linens, the massage supplies, and the restrooms. There are also state laws governing the minimum standards for health and safety of a therapeutic establishment. All practitioners should be familiar with their state's laws and requirements. Hygiene. Professional and personal hygiene are extremely important in establishing a therapeutic environment. All massage therapists should be familiar with the universal precautions and hand hygiene guidelines established by the Centers for Disease Control and Prevention, the CDC, and implement these practices as well as always practicing proper personal hygiene. Some universal precautions are providing adequate space around the massage chair or table to allow airflow and prevent infection between tables and chairs, maintaining all equipment used to perform massage therapy services in a safe and sanitary condition, which shall include but not be limited to repairing all cuts and nicks in the upholstery, cleaning all equipment coming in contact with a client, including hydrotherapy equipment, combs, brushes, shower caps, showers, tubs, and basins, with an antibacterial agent between each client usage. All equipment should be cleaned by the application of an antibacterial agent prior to and between each client usage. Face cradles and armrests on all massage chairs and tables must be cleaned with an antibacterial agent between each client, regardless of whether or not a single service material was used. Using all ice cubes only once, disposing of properly and cleaning trays after each use. Keeping well-maintained all ice and heat pack equipment. Storing and dispensing from suitable containers all massage lubricants, which shall include but not be limited to oils, soap, alcohol, powders, lotions, shampoos, and salts, in order to prevent contamination. To remove lubricants from containers in a sanitary manner. To keep multiple use containers such as pump bottles and tubes free of debris and sanitized between each client use and before refilling. Storing massage lubricants separately and from cleaning supplies. To store massage lubricants in a fashion that preserves their integrity. Use only clean linens and drapes. Storing all single service materials and linens off the floor in closed or covered shelves, containers, cabinets, or closets. Furnishing clean and fresh all single service materials and linens such as sheets, towels, gowns, and pillowcases used in the practice of massage for each individual client. And all soiled linens and drapes shall be professionally laundered and washed on a hot water setting with detergent and at least 1 cup of bleach or an antibacterial agent used in accordance with product labeling instructions in a closed washing machine and dried on a high heat setting in a dryer. And finally, no massage therapist shall store dirty linens, trash cans, or refuse in the closed shelves, containers, cabinets, or closets where clean linens and single-service items are also found. Hand washing before and after each client. Hand washing with soap and warm water remains a sensible strategy for hand hygiene in non-healthcare settings and is recommended by the CDC, the Centers for Disease Control and Protection. Gloves. The use of gloves does not eliminate the need for hand hygiene, and likewise, the use of hand hygiene does not eliminate the need for gloves. There might be times that gloves may be used for a massage treatment. Gloves reduce hand contamination by 70% to 80%, prevents cross-contamination, and protects clients and healthcare professionals from infection. Reducing the incidence of infection. The practitioner should never use bare hands to get lotion or cream from containers that are used on multiple clients. And all items touched by the practitioner and/or client during the session should be properly disinfected before the next client comes in contact with these items. These items include, but are not limited to, lotion tubes, bottles and pumps, linens, massage tables and/or chairs, and any therapeutic tools if used. You want to always comply with the current Centers for Disease Control and Prevention hand hygiene guidelines. Part 2, the profession of massage. This section will include the intake form, voluntary and informed consent, the interview, needs assessment, care plan, draping, scope of practice, competency, educational training, and finally, self-accountability. Let's begin. The client intake form. When clients arrive to your office for the first time, they should be required to fill out a client intake form. A client intake form serves many purposes in addition to providing information. The intake form includes the client's name, address, and phone numbers, the person to contact in case of emergency, insurance information if applicable, medical history, the reason for the visit, informed consent with a client's signature and date, and the consent to release medical information if necessary. The reasons for the intake form. It will make the client feel more comfortable in your office because it offers a familiar activity. Clients associate forms with medical offices or healthcare offices. By filling out an intake form in your office, the client will associate you with other legitimate healthcare practitioners. The client intake form. This form protects you in more ways than one. First, the client will list important health history on the form. This health history will help you determine any contraindications the client has. If the client neglects to list pertinent medical history and claims to be somehow negatively affected by your massage, you are protected from possible litigation. Second, if a client comes to you with less than honorable intentions in mind, the client intake form may discourage him or her from fulfilling these intentions. And finally, and perhaps most importantly, the information provided on this form helps you better treat the client because you are informed. Voluntary and informed consent. In order for the massage therapist to establish trust and comfort, as well as addressing any boundary issues a client may have, it's very important to have informed consent discussions prior to a therapy session. These discussions include the practitioner explaining to the client what they'll be doing during the session, why it's recommended, and how it will likely impact the client. These discussions give the client the opportunity to ask any questions and express any concerns about the procedure. It promotes an excellent opportunity for the client to express any boundary issues that may exist. It will also increase the client's participation in the treatment process and makes them more likely to do their part to make the session a success. Informed voluntary consent involves the practitioner having a discussion with the client about the type of work he or she will be doing, where they will be doing the work, and why it's recommended, and how it will impact the client. This is an excellent way to discover and address any boundary issues the client may have. The interview. After the client intake form is complete and while the client is still dressed, you conduct a client interview. Obviously, client interviews will vary according to the answers you receive from the clients. Guidelines for the interview. You want to conduct the interview in the treatment room. This way, the client is more apt to feel safe and respected during the interview. Clients tend to be uncomfortable revealing personal facts to you in your lobby or waiting room, where there may be other people present. The type of questions to ask are, where is the location of your pain? How intense is the pain? When did this pain start? And can you remember a certain activity that caused the initial onset of pain? Is the pain constant or is there a particular movement that causes it? Is there any numbness, tingling, or referred pain? And please describe. And have you been treated for this condition previously? And if so, what was the treatment and how did your body respond? Documentation. You want to document the responses to all questions in the client's chart. It may be helpful to use diagrams or a scale to document the areas and the intensities of pain. You use a number scale to document the intensity of pain, with 0 being no pain and 10 being unbearable pain. This is an example of an explanation you could use for your clients. Massage therapy is a very modest experience. Your body will be covered during the entire treatment. It is your choice to disrobe as much as you feel comfortable, although you will get a much more thorough treatment if you disrobe completely. During the session, I will work on only one body part at a time, and only that body part will be uncovered. When I am finished working on that body part, I will recover it and continue to the next body part. Do you have any questions? Needs assessment. As a massage therapist, you are likely to see clients in your practice in the same spectrum of massage for occasional relaxation, as part of their healthy regime to promote and stay healthy, to manage stress, and those who are seeking massage for treatment for a specific health issue. When we have clients who are seeking treatment on specific health issues, we need to conduct an accurate needs assessment, develop a plan of care with the client, and update the plan as needed. This assessment and plan of care includes assessing the condition to be treated and receiving informed consent from the client for the plan of care. The assessment includes determining if this condition is related to an injury or illness and the cause and date of this injury or illness. For example, was the injury caused by an auto accident? Was it work-related or any other activity the client was involved when injured? Or was this result a condition of an illness? For example, is the client recovering from a surgery or managing symptoms of a condition like diabetes or high blood pressure? Included in the session closure, you want to state when you feel the client should return, how long his or her sessions should be, the areas of the body that require specific attention, any exercises that the client might perform to hasten results, and activities that the client should avoid between sessions, when a client should notice results, what the client might feel as a result of massage therapy, like a bruised feeling, possible nausea if deep tissue is performed, lightheadedness as a result of blood pressure decrease, etc. You want to inform them of the importance of drinking water after the massage. And finally, at the close of the session, you should follow certain guidelines. You want to discuss a specific treatment plan for your client, and you want to define the goals that you hope to achieve with massage therapy. You want to write the client's progress in his or her chart. The care plan. The plan of care includes determining, based on your scope of practice, the number of times per week and how many times a week the client should receive treatment. You should have an informed consent discussion with your client about the treatment and plan of care. And of course, you want to update your plan of care as needed. For example, to either lengthen or shorten the plan of care, or use different techniques if the client is not making expected progress. Draping. Proper draping is critical in order to foster a sense of safety and emphasize your professionalism. Always instruct the client to undress to their comfort level or to which articles of clothing to leave on or take off. Always uncover only the area that is being worked on and recover it when done and moving on to the next area to be worked on. And you never want to work under the drape. The scope of practice. The massage therapist should know that what their training and limitations are and practice within these limitations at all times. The first thing to always remember is the decree proclaimed by Hippocrates over 2,500 years ago for all helping professionals, which is to do no harm. If you are practicing outside of your training and limitations, you are potentially putting your clients at risk for harm. Scope of practice. The law. Laws vary from state to state and are changed or updated frequently. All massage therapists should stay informed of their state's laws and adhere to the local and state laws that govern their profession. Educational training. All massage therapists are expected to ethically work within their individual education, training, and limitations. It is important to also remember that even though there may be a law that permits a specific modality to be practiced, if the practitioner does not have proper education and training in that modality, they should not practice that modality on a client. Competency. Beyond the massage therapy certification program, there are many advanced studies that can be pursued. Advanced training classes raise the question of what actually determines certification. Is a weekend workshop, a video, or reading a book adequate training for certification and competency? A disturbing number of practitioners are claiming credentials in various disciplines or specialities only after an introductory workshop or a few hours on the subject. If a credential is to mean anything of value, it must represent meeting a certain standard of quality or the significant mastery of a particular area, and not just a passing familiarity. Self-accountability is required for all massage therapists in determining competency. An ethical practitioner must know their limitations based on their individual education and training and never work outside of their scope of practice. Self-accountability. Self-accountability is ultimately the determining factor for the massage therapist to ethically practice within their scope of practice. Regardless of the code of ethics you subscribe to or your personal beliefs, It is self-accountability that enforces the scope of practice. Your self-accountability is the behavior you are answerable to and accountable for in the absence of external authority. All practitioners should internalize the laws and guidelines that define the limits of practice to eliminate the risks of violating their professional scope of practice and ethical responsibilities. Refer to other professionals. Massage therapists should always refer a client out when they are presented with a client who is seeking treatment outside of their scope of practice. The massage therapist should also refer a client out if they feel an attraction towards a client or if they feel a predominantly negative feeling toward a client, or in any situation where a healthy therapeutic relationship is compromised. When in doubt, refer out. Seek professional advice when needed. This can be a mentor or a supervisor or other more experienced massage therapist. Having a mentor is a form of support with a more experienced colleague who is available to answer questions and offer guidance. This is an invaluable relationship. No one is expected to start a practice without help and support, so never be afraid to talk with other professionals about common issues. This helps us know we are not alone or unusual in the problems we are having. Respect other healthcare professionals. It's unprofessional and unethical to imply that our skill level or our method of manual therapy is superior to either another practitioner or another kind of work. This comes from Nina McIntosh's book, The Educated Heart. We should always strive to having relationships that are characterized by or having respect equally among colleagues. Don't knock others. When we malign, to speak maliciously and harmfully of other practitioners, it makes us look insecure in our client's eyes. If we make a critical remark about the practitioner the client is seeking or has just seen, it can sound as if we are being critical of the client's judgment. You want to always avoid talking carelessly, any kind of gossip, personal remarks, or assessments about the competence of another practitioner. We all have ex-clients who think we're skilled and compassionate and those who don't. We want to take care of another practitioner's reputation. And the same thing goes for maligning other kinds of manual therapies or alternative health practices, or being disrespectful of the medical profession. It just makes us look small and can offend clients loyal to that kind of treatment. That comes from The Educated Heart by Nina McIntosh. Negative results of avoiding responsibility. Nathaniel Branden says it well. Quote, tales of a lack of professional responsibility are rampant. The chronically late person who blames a malfunctioning alarm clock, the alcoholic who blames a decade-old divorce, and the speeder who swears the patrolman that the radar must be broken. End of quote. Being overly dependent on others for recognition and acceptance, or being hostile or depressed over how unfairly you've been treated, being unsuccessful in relationships and in the enterprise taken in life, or being unable to develop trust, as it is hard to trust others when you yourself are not trustworthy. The main consequence of blaming others for what happens in your life is that it undermines your ability to know how greatly your own thoughts and actions determine your ability to exceed in life. Blaming others keeps people stuck in a victimhood, powerless, and fearful mode. We'll now go to examine part 3, which is massage therapy business essentials. We begin with record keeping. You always want to maintain accurate and truthful records. These records include, but are not limited to, the client history, the SOAP notes, schedules, accounting, licensing, bookkeeping, continuing education, and malpractice liability insurance. Confidentiality. You always want to respect the confidentiality of the client information and safeguard all records. It's a good idea to discuss your privacy and confidentiality standards of practice with your clients before the therapy begins. This will help to establish a trusting environment and a healthy therapeutic relationship. Protecting the client. You want to protect the confidentiality of the client's identity in conversations, in all advertisement, and any and all other matters unless disclosure of identifiable information is requested by either the client in writing, is medically necessary, if it's required by law, or for purposes of public protection. The Health Insurance Portability and Accountability Act, also known as HIPAA. According to HIPAA, the following entities are required to be compliant: healthcare plans, healthcare clearinghouses, and healthcare providers who transmit any health information in electronic form. Even if you don't use electronic claim submissions, you're not exempt. If you plan to email or fax or in any other way transmit information electronically from you to your client, you are responsible. Electronic transactions and code sets standard requirements and require the use of standard codes for electronic submission for insurance claims forms in states that allow that. You're also dealing with privacy requirements, which governs the disclosure of the client protected health information, security requirements, and a national identification number requirement if you're in a state that has that. The HIPAA law, it's not only a professional and ethical practice to guarantee your client's confidentiality, but the failure to comply with HIPAA regulations can result in civil and criminal penalties. Violations can range in fines from $100,000 to $25,000 per violation per year. The violators for knowingly violating HIPAA, which is under false pretenses or with an intent to sell a client's information, can result in fines from $100,000 to $250,000 and 5 to 10 years of imprisonment. All massage therapists who bill insurance companies for massage services must be HIPAA compliant. Minors. Working with clients who are minors or otherwise unable to give voluntary and informed consent deserves special consideration. Written permission from a guardian or appropriate third party is required. However, the minor client retains the right to withdraw that consent for massage at any time. Because of the sensitivity to ethical practices when working with minors and clients who are unable to give voluntary and informed consent, massage therapists should have a heightened awareness to their ethical standards when working on these clients. The majority of children receiving massage are involved in athletics. Child athletes often receive massage early on as either a prevention strategy or as part of their rehabilitation after they have sustained an injury. Many times a parent or guardian has reaped the benefits of a good deep tissue and sport massage therapy session for their child. They see the benefit and want their children to enjoy the positive aspects of a regular deep tissue massage as well. A good massage is a valuable thing for child and adult. For children, a massage provided by a professional therapist in a safe place helps the child understand the value of the therapeutic touch and the power they have over their own bodies. As a professional massage therapist, communication is one of your most valuable skills. And communication is extremely important in any massage session, but it's exponentially more important when working with children. The power differential that is possible between an adult and a massage therapist is now nothing compared to the potential power differential between a child and a massage therapist. You are essentially on the level of a doctor as far as the child is concerned. They are being told they need a massage by their parents, and all of a sudden they have someone they have never met touching them. Based on my experience working with child athletes from many different sports of many different ages, I have established what I believe to be 3 unbreakable guidelines when giving a child a massage. Guideline 1. No child shall be massaged without a parent or guardian present. This is actually one of the primary rules of the USA Swimming and many other organizations with child athletes. It's an extremely important guideline that recognizes the importance of power differential and takes steps towards eliminating potential problems caused by them. Having a parent or guardian present when performing a deep tissue or sports massage on a child athlete serves 2 main purposes. The first purpose is to help the child relax by creating a safe space for them. You are a stranger to them. Having their parent or guardian in the room helps them understand they are being watched out for and are not at the mercy of a stranger. And the second purpose is protection for yourself. Children may not understand a specific technique or therapeutic touch you do. If the child misinterprets your intention, this misunderstanding can quickly spiral out of control. With a parent or guardian in the room, observing your actions, there can be no misunderstanding of what was done and what was not. Guideline number 2. Over-explain every single thing you do. Many adults don't understand what is going on when they are receiving a massage. If you over-explain what you are doing, every single time you put your hands on the child's body, you are helping the child understand what is happening as well as informing the parent or guardian of what is going on. Another important aspect of over-explaining with a child has to do with tolerating unnecessary pain. Being an athlete, it's important that they should breathe and focus on relaxing their body as you work with them, as well as adjusting any pressure by asking them, how are they feeling? And guideline number 3, get permission. Many young teenagers are going through changes with their bodies and have a tendency to become confused about the difference between therapeutic touch and sexual touch. When you massage children, especially teenagers, it's extremely important to get permission to touch them. Not only does this show the child you respect their decision, thus empowering them, it also serves as an opportunity to explain what is going on and why you need to massage a specific area. Professional information only. To establish and maintain healthy therapeutic boundaries, it is important to ask only for information that is relevant to the therapy the client is seeking. It's unprofessional, unethical, and inappropriate to solicit information that is not relevant to the therapy the client has given informed consent to receive. You always want to avoid the temptation of prying into a client's personal information for any reason. You always respect your client's boundaries to their privacy. Exception of sharing information. There are 2 limits of ethical confidentiality. One is the massage therapist's records are subpoenaed by legal system, and 2, if there is a clear and imminent danger to the client or the public. For example, if you suspect the abuse of a child, an elderly person, or an incapacitated individual, or if the client has expressed an intention to commit a crime, you should consider these times of breaking confidentiality. It's a good idea to consult a mentor or supervisor before action is taken. During these conversations, the name of the client is withheld and only the details of concerns are discussed. Client files. It is required by many states' laws and rules that records must be kept for at least 4 years for auditing purposes. Storage and disposal. Records must be kept and destroyed in a way that is to safeguard against unauthorized access. Business practices. The massage therapist shall practice with honesty, integrity, and lawfulness in the business of massage therapy. Having a safe environment. Your physical setting is the first thing your new client will likely see, and a clean and safe physical setting is the first step in establishing trust and comfort with your client. Beginning with the parking lot, the parking area should be free and safe from debris and all inappropriate material. Waiting rooms and restrooms should be properly cleaned and sanitized, and the therapy room should also be properly cleaned and sanitized and free from clutter. All walking areas should be free from debris, and items that could cause a potential tripping or falling hazard must be removed. State laws vary, so be sure to check your state laws and rules for establishment requirements. Professional malpractice liability insurance. Liability insurance for the massage therapist is available from several different companies and through various organizations like the American Massage Therapy Association, the Associated Bodywork and Massage Profession, and Hands-On Trade Association. You can compare prices and coverage online by searching for liability insurance for massage and body workers. Liability insurance is required for all massage therapists. Client records for insurance claims. If you are going to be filing any type of insurance claim, private healthcare insurance, personal injury, or workers' compensation, you are required to keep progress notes for each client session. You will have to submit your notes with your insurance claim. Other times, when it is a good idea to keep notes are when receiving a client referral from a physician or other healthcare provider. When the client has specific needs and goals that will require a series of sessions, and any time that it would be beneficial to track improvement or lack of improvement of a client's therapy sessions. Truth and information. We need to be honest with our prospective clients about the work we do. It is unethical to make false claims or inflated promises. We need to be honest about the benefits and expectations of our work as well. We should never guarantee results. We cannot predict the outcome of our treatments. We can tell our clients things like, many people do experience pain relief from their physical symptoms with massage therapy, or many people experience less tension and stress, or many people experience fewer headaches and sleep better at night with massage therapy. We must always avoid even the slightest suggestion that we can cure or fix a client's condition or emotional problems. Representation of credentials and affiliations. It's unethical to misrepresent credentials. If credentials are meant to mean something, substantial time must be spent learning and practicing a modality before a massage therapist can ethically claim qualification, confidence, education, training, and experience in that modality. You never want to claim to have qualifications or credentials that you have not earned. It's also unethical to falsely claim an association with an affiliation that is not true. In order to claim affiliation with a professional organization, you must actually be a member of that organization and adhere to the policies and procedures, as well as subscribe to the code of ethics and standard of practice of that organization. If you have affiliations with organizations, you should proudly display your certificate of affiliation where your clients can see them. Affiliation to professional associations lets potential and new clients know that you have met the required education and training criteria that are qualified to offer massage therapy. Managing conflict. Always promote yourself and your business with honesty and sincerity. Presenting ourselves with integrity will tell our prospective clients and colleagues and other healthcare providers what kind of person and professional we are. You want to always avoid potential and actual conflicts of interest in promoting ourselves, which is important as well. You can avoid conflicts of interest by being an ethical massage therapist. Truth in marketing. Marketing can be essential to our massage therapy practice, and if it's done correctly, marketing can greatly enhance our business. But there are some major marketing mistakes that you'll want to avoid, such as making exaggerated claims or utilizing misleading ploys, or displaying inappropriate images, not following state regulations, or misrepresenting our credentials. Ethical advertising. Ethical advertising is a must. You want to always advertise in a way that is honest and truthful about the services that we are and can provide. If you advertise a specific modality, you are required to have the training and credentials to back up your claim. You can list modalities you have had training in, but avoid referring to yourself as a specialist or expert if a modality you have when you only took a weekend course or read a book. Never use language or pictures in your advertising that could be interpreted as sexual or provocatives. If you use words like release, total relaxation, and full body massage, that could sound like masked sexual references. If you use pictures in your advertising, make sure they are professional, not copyrighted, and royalty-free photos. Be sure to look at the pictures from all angles to make sure they cannot be perceived as provocative or sexual. Sexual harassment issues. Sexual harassment can occur in a variety of circumstances, including, but not limited to, the following. The victim, as well as the harasser, may be a woman or a man. The victim does not have to be of the opposite sex. The harasser can be the victim's supervisor, an agent of the employer, a supervisor in another area, a coworker, or a non-employee. The victim does not have to be the person harassed, but could be anyone affected by offensive conduct. Unlawful sexual harassment may occur without economic injury to or discharge of the victim. The harasser's conduct must be unwelcome, and it's helpful for the victim to inform the harasser directly that the conduct is unwelcome and must stop. The victim should use any employer complaint mechanism or grievance system available. Exploitation. Exploitation is the unethical use of a situation or person for one's own profit. It's essential that our clients, employees, and coworkers can trust and depend on us without a concern of exploitation. Examples of exploitation of trust and dependency are violating the privacy of personal information, being dishonest about credentials and modalities of expertise, making false claims or guaranteeing benefits or results on services provided. You can avoid the possibility of exploiting others for your own personal gain by having strict standards of practice and moral and professional standards of conduct. Understanding financial fees. All clients and prospective clients should have a clear understanding of your payment methods accepted prior to beginning a session with that client. You can display this information where the client can easily read, but you should always include a discussion or signed statement from the client to ensure there are no misunderstandings of when and how payment is expected. Acceptable accounting practices. All massage therapists should keep accurate records of their income and expenses. If you are not sure of how to set up an acceptable accounting system for your practice, consult an accountant to assist you and help you find legal ways to reduce your taxable income. Taxes. All income must be claimed. That includes tips and bartering and is subject to federal income taxes. State and local income taxes vary. It is important for you to know your state and local government's tax laws and fully comply with them. If you are an independent contractor, you need to file quarterly, which is January 15th, March 15th, June 15th, and September 15th. If you are an employee, you must file annually by April 15th. There are several deductions for a massage therapist, so take advantage of them. It is legal to avoid paying taxes. That is what deductions are for. What is illegal is to evade paying taxes. You want to maintain accurate financial records, contracts, and legal obligations, appointment records, tax reports, and receipts for at least 4 years. Records that include the personal and private information of clients, including addresses and names, phone numbers, and health history, must be kept securely where they cannot be accessed by unauthorized personnel. Part 4. The psychology of massage therapy. Roles and boundaries. Our role as a massage therapist means that we agree to behave in certain ways with our clients. As professionals, we present ourselves and behave in a professional way, keeping our professional lives, opinions, and needs out of our sessions. And we present our specific training honestly and accurately and stay within the scope of our practice, never working outside of our expertise. We all have both physical and emotional boundaries that provide us with a sense of safety. They are how we determine how close both physically and emotionally we want to be with someone. We may not even be aware of our boundaries until they are crossed. When our boundaries are crossed, most often we will respond with resistance and have a negative response. When we cross our clients' boundaries, it is likely they will respond similarly and potentially damage the therapeutic relationship. All massage therapists have at some time crossed a client's boundaries, and usually these mistakes are small in nature and can be corrected. We are all human and we all make mistakes. Our challenge is to be aware of our clients' boundaries and honor them. While being tolerant of our imperfections, we must always learn from our mistakes. If we stick to our professional role, we will not experience trouble crossing our clients' boundaries. Non-exploitation. It's important for us to understand the influential position or power differential we have with our clients. There are natural power imbalances in many relationships, including teacher-student, parent-child, and healthcare provider-client. The student, child, or client will look to the teacher, parent, or healthcare provider with esteem for their knowledge and guidance and ability to help them. This puts the student, the child, or client in a vulnerable position. So it's important for the person in the position of power to never abuse this power for personal or other gain. In the therapeutic relationship of the practitioner/client, the power differential is increased by the undressed and partially undressed client, the physical positioning of the practitioner standing over the client, and by the practitioner making physical contact with the client's body. It's always important to ask yourself, how am I handling this power? The practitioner may be tempted to take advantage of the client either physically, emotionally, financially, or professionally. Examples of taking advantage of a client's vulnerability includes soliciting a product, a service, or a sponsorship during a session, or asking a client's advice relating to their profession, or using the therapeutic relationship to make other professional or personal connections, or receiving personal services and gifts from the client. The massage therapist must always maintain an ethical practice and conscientiously decide to maintain the integrity of the client's boundaries by consistently saying no to something he or she could easily gain because of the influential position or power differential. The practitioner should always pay special attention to the best interest and well-being of the client, the person with lesser power. Ultimately, it is always the practitioner's responsibility to ensure that the therapeutic relationship is ethical and structured to benefit the client and never exploit the relationship for personal or other gain. Transference. Transference is an unconscious and normal occurrence that is inevitable in a therapeutic relationship where there is a power differential. In transference, unresolved childhood issues, feelings, and needs are transferred to the massage therapist. Transference can be defined as the inappropriate repetition in the present of a relationship that was important in a person's childhood. Some examples of transference are if the client asks you questions about your personal life, even though your policy states that your call should be placed at your office, the client calls you at home. Or the client overly showers you with compliments about what a wonderful person you are and the work that you do. Even though you have clearly stated your policy, the client keeps trying to bargain with you for a reduced rate. Or the client regularly requests you to accommodate his or her schedule by changing your schedule to work at a time when you do not normally see clients. Or a client continuously brings you gifts. Even though you have explained your policy of not socializing with clients, a client feels rejected every time they invite you to a social occasion and you decline. Or if the client asks for a little bit more work at the end of most treatment sessions and expresses disapproval if you do not comply. Or if the client asks you to help him or her with personal problems. Or even though you have explained your scope of practice, the client frequently asks you questions in areas that are not in your scope of practice. Or if the client mentions to you to remind him or her of someone they know. Or if the client attempts inappropriate hugging or touch at the end of each treatment session and has a difficulty maintaining physical boundaries. And if the client does not want to leave after a session and tries to engage you in conversation to stay longer. Now we'll take a look at counter-transference. Counter-transference is when this happens in reverse. The therapist's unresolved childhood issues, feelings, and needs are transferred to the client. Countertransference is also unconscious and a normal occurrence. there is either a strong positive or negative emotional charge toward a client. The practitioner may have an idealized view or feel very negatively toward a client when thinking is distorted. When a client chooses not to change, is not improving, or is not cooperating with the prescribed treatment plan, the practitioner feels irritable, energy, or angry. Sexual activity. The massage therapist shall refrain from any behavior that sexualizes or appears to sexualize the client-therapist relationship. You want to refrain from participating in a sexual relationship or sexual contact with the client, whether consensual or otherwise, and refrain from the beginning of the client-therapist relationship for a minimum of 6 months after the termination of the client-therapist relationship, unless a pre-existing relationship exists between a student for certification or a client prior to the certificate for certification. Sexual activity includes any verbal or nonverbal behavior for the purpose of soliciting, receiving, or giving sexual gratification. Suggestive or seductive gestures or expressions, improper draping, inappropriate comments or jokes having a sexual nature, inappropriate touching, inappropriate comments about a client's clothes or body are all considered sexual activities. The massage therapist should avoid all sexual activities at all times with all clients. It's also important for practitioners not to sexualize their work. If a massage therapist accepts someone as a client, but is also trying to engage them for a possibility of dating, they are sexualizing their work. If a massage therapist dresses in a certain way they think a particular client will find attractive or provocative, they are also sexualizing their work. If a practitioner finds himself participating in sexual activity or sexualizing their work, they should talk to a supervisor, counselor, or psychotherapist. There is also sexual attraction toward a client and massage therapist. The therapist should refer the client to another practitioner. Freedom of choice. Clients always have the right to accept or decline therapy or treatment of any kind. It would be considered unethical to not acknowledge the client's right to their freedom of choice. It may be tempting for some massage therapists to ignore this right, especially if they know the clients present symptoms in which their massage therapy techniques could be beneficial. However, if a client is not open to receiving treatment, the work would not only take away their right to choose, but also create a situation in which the client may not feel safe receiving any therapy or treatment from a massage therapist. We must always allow our clients to be in complete control of the therapy they receive. If for any reason a client chooses not to receive the therapeutic session or any part of the session, we must always honor their right to choose. We must resist the temptation of thinking that we know more about the client's body than they do. We can, however, discuss with our client the reason we believe a particular treatment would be more beneficial. This way, the client can receive your professional opinion but not be pressured in any way to receive therapy they do not wish to receive. Under the influence. We should always avoid a session under the influence of any substance that could possibly impair our perception or logical thinking. Regardless of what substance, we must always recognize that when our perception or logical thinking could be impaired, we make our client's health and well-being our first consideration. Not only would it be unprofessional and unethical to show up for work impaired by a substance, it also poses a risk of harm to our clients. You want to refrain from practicing under the influence of alcohol, drugs, or illegal substances, with the exception of a prescription dosage of a prescription medicine. If we are refusing to work with a client who is impaired by alcohol, drugs, or any illegal substances, we can explain our policy is not to offer services to anyone who is impaired by a substance to avoid any possible contraindications that could have an adverse effect on their health, and ask them to reschedule their appointment at a later date when they can receive a massage therapy session unimpaired by any substance. We have the right to refuse and/or terminate the service of a client who is abusive or under the influence of any substance that would hinder the client's perception or logical thinking. When we decline to work with a client, we must do so professionally. When we refuse to work with a client for any reason, we must remain non-judgmental of the client and non-argumentative. Putting the responsibility in ourselves and saying something like, "I'm just not comfortable working with you," will eliminate statements of judgment and leave no room for the client to argue. If we made a comment to a client such as, "You are abusive, I just can't work with you," this leaves room for the client to disagree and argue about their behavior. The acceptable standard for pursuing a relationship with a client is to end the massage therapist relationship and wait a period of 6 months before pursuing a potential personal relationship with a former client. This will avoid unethical behavior and establishes an opportunity for a healthier relationship with this person by completely dissolving the massage therapist-client relationship, allowing for more balanced, parallel, and equal partnership to be established, creating a solid foundation for a healthy relationship. It's a good idea to address the therapeutic nature of massage when scheduling a new client, and inform the prospective client there will be no sexual behavior during a session. You might say something like, "To ensure that we both have the same intention, I always let my new clients know that I offer massage therapy session and there is no sexual activity during the session." You can follow this with your rate schedule and payment policies. If you do not have the opportunity prior to scheduling appointments to address these issues, for instance, if you're practicing massage in a place where someone else schedules appointments for you, you can discuss these issues with a new client during the interview before the session begins. Physical arousal. While physical arousal can occur with both male and female clients, a woman's arousal is typically less visible. Fear of an erection or a practitioner's response to it prohibits some men from seeking a much-needed massage therapy session. For those devoid of inappropriate intentions, education about normal body functions can ease this fear and invite a new level of comfort with somatic-based therapies. If there is any discomfort on the part of either the client or the practitioner when an erection occurs, it must be addressed. If not resolved, the session is to end. Addressing any discomfort with sexual issues. Discomfort on the part of a client or a practitioner will divert the focus of the therapy, resulting in decreased effectiveness. If the therapist notices any client discomfort, such as a body tension or facial flushing, then it would best serve the client to talk about it. Because the antidote to a parasympathetic response is the activation of the sympathetic nervous system, changing the technique being used can quell a spontaneous erection. The sympathetic nervous system can be activated by increasing massage pace and pressure. This increase should be moderate and is not intended to alarm or cause pain to the client. Professionally managing human interaction surrounding this type of arousal requires preparedness, maturity, and education. Meanwhile, communication regarding client behavior, therapeutic intent, and the physiological normalcy of erections allows a practitioner to preserve ethical boundaries while maintaining respect for the client. Part 5. Spa and Clinic Worth Ethics. Here are a few issues encountered in a work situation like at a spa or a health clinic. Your code of ethics exists in a session with a client as well as with coworkers. Favoritism. Scheduling one massage therapist over another because the receptionist likes that one better, or keeping only favorite employees in a loop about specials or promotions, or offering perks such as free classes or training to certain employees and not others, or inviting everyone to lunch except one person. These are to be avoided. Stealing clients. Actively taking regular clients away from coworkers or bad-mouthing coworkers, or calling clients on the phone, or giving out personal business cards and or your phone number to spa clients, or taking the client base with them when they leave the spa or clinic. These should be avoided. Offering services or incentives for free, like giving clients extra or add-on services like hot stones or aromatherapy for free, while other massage therapists in the same spa charge for them, or going over time limits as a special incentive to clients, or giving free products to take home. These should be avoided. Taking advantage of other massage therapists, such as using the sheets, oils, music set up by other massage therapists without replacing them, or not cleaning up after services and leaving trash around, or keeping dirty sheets on the table, or hoarding products including the massage cream with arnica, props like special pillows and CDs so other massage therapists don't have access to them. These should be avoided. Or stretching boundaries, having after-hour parties that include alcohol, or taking extended breaks that sometimes last twice as long as scheduled, or showing up late for work even when clients are scheduled. These should be avoided. Team playing. As an employee, what you can do is to follow the golden rule, which is to treat others the way you wish to be treated. This goes for relationship with clients, coworkers, and bosses. Personal ethics. Find your personal standards and stick with them, and discover your personal integrity and what lies you won't cross. Use your massage code of ethics and have discussions with the spa owner or manager about your boundaries. Employee relations. Talk with, not at, your fellow employees. Have a conversation, not a lecture. Ask questions about policies you don't understand or modalities you were not taught. And be friendly with everyone. Communication is key. Don't be afraid to talk with the boss and clarify something or discuss a problem you've noted. Keep conversations short and private, and no naming names, just situations. If you are to leave your job, leave with dignity. Don't burn your bridges. It's important for a good referral to leave on good terms. This means no temper tantrums, no walking out the door throwing things, no backstabbing. Give your 2-week notice and leave on the last day and not before. And don't burn your bridges. Here are some of the resources that I used in this presentation. Congratulations! Now that you have finished this presentation, you must complete the final exam that was sent by attachment. Make sure your name and license number are on the bottom of the exam the way you want it printed on your e-certificate. Email the completed exam to pcnuovo@yahoo.com. To satisfy your Ethics for the Massage Therapist online class requirement, you must achieve a final score of 70% or higher. An e-certificate will be emailed to you at the email address you provided upon registration. If you have any additional questions, please feel free to email me. Thank you for your participation for this NCBTMB approved online continuing education class. You might also want to check out these additional NCBTMB approved continuing education distant learning classes for massage therapy. Beacon Wellness Arts Center is approved by the NCBTMB as a continuing education approved provider, number 450919-09, sponsored by the NCBTMB to teach New York, Florida State Board of Massage Therapy, number 50-14392 with CE Broker, Texas, Oregon, Washington State, New Jersey, Pennsylvania, Illinois, North Carolina massage therapists continuing education, as well as 20 other states that require NCBTMB continuing ed approval. This course contains information that is proprietary. None of the materials contained within this course may be used without the express written permission of Beacon Wellness Arts unless otherwise indicated in the course. As a reminder, before practicing any new modalities or techniques, check with your state massage therapy regulation authority to ensure they are within the state's defined scope of practice for massage therapy.